I'm Dr. Katija Khan, a lecturer in clinical psychology at the University of the West Indies in Trinidad and Tobago. I'm also an executive member of the Trinidad and Tobago Association of Psychologists, and I'm on the Executive Council of the Caribbean Alliance of National Psychology Associations. My interest in suicide prevention is actually quite broad. So I think from a clinical point of view, it is a significant problem in Trinidad and Tobago and in many of the Caribbean countries. So I think it's something that needs to be addressed from a public health perspective, but also the social scientist in me is intrigued by some other aspects. So in terms of the cultural meanings and interpretations that underlie suicidal ideation, suicidal behavior. So I'm also particularly interested in the cultural narratives that surround suicide. So one of the things that I'm interested in is looking to see what the differences are between the persons who die by suicide and persons who attempt. So what are there demographic differences? Are there reasons, the precipitating factors different? So that's one of the things I've been working on and doing some research on. The other thing I'm looking at is in 3 of the Caribbean countries that have the highest rates in the region, that's Trinidad and Tobago, Suriname, and Guyana. These are also the 3 countries that have a large Indo population, persons of Indian descent, and they tend to be overrepresented among persons who die by suicide. So I'm very intrigued by that disparity to see, and I'd like to investigate what are some of the underlying cultural factors that could explain or better inform our intervention and prevention efforts. That's a very intriguing and exciting question, and I'd have lots of plans. So one of the things we've found, I'm also an executive of the Trinidad and Tobago Association of Psychologists, and we just recently started launching some public awareness seminars, and the public interest has been astounding. People want information, they want to talk about it, they want to find out how can they help. So some of the monies will definitely go towards having a public awareness campaign, a caravan that goes around the country, and especially to underserved areas. So one of the issues is we have limited resources, so we usually concentrate public campaigns in the highly populated areas, and so underserved areas, geographically remote areas, don't have access. So with an unlimited budget, we'd be going everywhere, and we'd be able to hire more people to provide that service. Another big chunk of that budget will go to research, because I think research is going to better inform practice, and so we need to get the information. One of the issues we also have in the Caribbean is a lack of data. So some of the research, or even some of the monies, will go towards improving our surveillance and monitoring systems, our data capture systems. And since it is an unlimited budget, I think some more money would go to training and education and capacity building. So in terms of making sure that suicide is on the curriculum for all mental health professionals specifically, and that we're building capacity among the mental health professionals, and also not just focusing on the mental health professionals, but also the training lay people to help support as well. So whether that comes as psychological first aid or more specific interventions towards suicide. And an unlimited budget. That's fascinating. So with just staying with the research, in terms of the publication and the dissemination of information, so the Caribbean region, we are many different islands. So we have a geographical barrier, but with the information gateway now, so I'd want to make sure we have online repositories, areas that people can access information and share knowledge, because often we have like-minded people who are interested, and we need to find a way to pool those resources. So if we could establish more links where we can share, improve on each other's effort, have a synergistic effort. And I'll stop there. Yes. Yes, I think actually one of the key messages would be very simply that suicide is preventable. I think suicide is it's a taboo topic. It's a scary topic. And so a lot of people, although it's of great concern, they're scared and they feel powerless and hopeless. So not just the persons who are affected by it, but even friends and families and loved ones in general. So I think spreading that message that it's preventable, I think imbues a lot of hope. It empowers people, and it gives people an avenue to focus on. If it's preventable, then what can we do about it?